Have you ever found yourself wondering why clinicians and doctors request a urine sample? You see, that little cup of urine holds a wealth of information about your health status. It's like a miniature health report, revealing valuable insights that can guide medical professionals in assessing your well-being. By analyzing your urine, medical professionals can glean a multitude of information about your well-being. But what happens after you hand over that cup? Today, we'll take a closer look at the crucial steps involved in proper urine specimen collection, transportation, processing, culture, and biochemical identification. Before we move on to the process of collecting urine, let's familiarize ourselves with the 6 types of urine collection methods commonly used in medical settings. The first one is midstream clean catch urine collection. This is the most common method for routine urine analysis. It involves collecting a sample of urine midstream into a sterile container after the initial part of urination has passed, ensuring that the sample is representative of the urine in the bladder and minimizes contamination from the urethra. The second method is 24-hour urine collection. This method involves collecting all urine produced over a 24-hour period to measure substances that may vary throughout the day, such as certain hormones or protein excretion. The collection starts after discarding the first urine sample and ends with collecting the first urine sample of the next day. Next is the first morning void. This method involves collecting the first urine sample of the day, typically upon waking up in the morning. It is commonly used for pregnancy tests or when a concentrated sample is needed. We also have random urine sample. This method involves collecting a urine sample at any time of the day without specific instructions for timing or preparation. It is often used for basic urine analysis to check for infections, glucose levels, or drug screening. Then, pediatric urine collection. For infants and young children who are unable to provide a clean catch sample, urine collection methods may include using a urine collection bag or a urine collection pad placed in the diaper. The last one is catheterized urine collection. This method involves inserting a catheter through the urethra and into the bladder to collect urine. It is typically used when a sterile urine sample is required or when a person cannot voluntarily urinate. Collecting a urine sample for medical testing or analysis is a common procedure that requires attention to detail. To ensure accuracy and reliability, it is crucial to emphasize the importance of thorough hand washing and using the appropriate container. Thoroughly wash your hands with soap and water. Clean hands are vital to prevent the introduction of contaminants into the urine sample. By practicing proper hand hygiene, you reduce the risk of compromising the integrity of the sample and ensure accurate test results. Also, ensure you have the right and suitable container for urine collection. Your healthcare provider will provide you with a clean, sterile container specifically designed for this purpose. Using the proper container helps maintain the stability and integrity of the urine sample during collection and transportation. Once the urine is collected, we can then send it to the lab for further analysis. To transport the urine to the lab, remember to label the container. Clearly label the container with the patient's name, date, and time of collection. This helps to prevent mix-ups and ensures accurate identification. In the meantime, ensure that the container lid is tightly sealed to prevent leakage during transportation. This is important to maintain sample integrity and avoid contamination. Protect the sample by placing the sealed container in a secondary leak-proof bag or container to provide an extra layer of protection against any potential spills or leaks. Then, transport the sample as soon as possible. The urine sample should be transported to the laboratory within 1 to 2 hours of collection ideally. But if you're unable to deliver the urine sample to the laboratory immediately, it's essential to keep it cool to prevent bacterial growth and degradation of certain components. You can place the container in a small cooler bag with ice packs or refrigerate it if available. Avoid freezing the sample as it can affect the test results. Next, let's take a look on urine processing in microbiology. Once the urine samples reach in the lab, make sure to check the request and ask the time when the patient collects the urine to avoid any potential discrepancies in the testing process. Accept the urine if it passed the criteria of specimen collection, then put it on the microbiology section. After logging in the information in many logbooks, we are now ready to streak our sample We have to streak it first on the blood agar, then following the McConkey agar. Then put it in the incubator to allow bacterial growth. We will check it on my next duty, tomorrow afternoon. As you can see in blood agar plate section, the colonies are circular convex, smooth, grayish white, and opaque. While on McConkey agar, the colonies are flat, dry, pink, with a surrounding darker pink area of precipitated bile salts. To further identify the bacteria, we will perform gram stains so that we can observe the bacteria morphology under the microscopy. For urine sample, there are 4 biochemical tests will be performed to identify the presence of specific bacteria. The 4 tests are indole test, methyl red Voges, Proskauer test, MRVP, and citrate utilization test. Based on the appearance of the colony and the 4 biochemical identification test result, the bacteria is Escherichia coli. To make this result more convincing, we can subculture some colonies in EMB agar to see its unique appearance. On EMB agar, the growth of Escherichia coli will give a distinctive green metallic sheen. Escherichia coli, or E. coli, is the most common cause of urinary tract infection in women. Therefore, the identification of E. coli in a urine sample, along with clinical symptoms and other diagnostic tests, supports the diagnosis of a UTI caused by this specific bacterium. Other than Escherichia coli, there are also several other types of bacteria that can be detected in a urine sample. Some of the common bacteria that may be identified in a urine culture include Staphylococcus saprophyticus, Klebsiella pneumoniae, Proteus mirabilis, Enterococcus faecalis, Pseudomonas aeruginosa, and Enterobacter species. All right, that's all for today. Did you enjoy learning new things? I'm glad if you did. I hope that this video has provided you with a lot of valuable information that will enhance your understanding of the topic. Remember, knowledge is power, and the more we learn, the more we can grow. Thank you for watching, and until next time, keep exploring, keep expanding your horizons, and keep embracing the joy of learning.